Dear all, we are going to see some important landmarks and its clinical significance as well as MCQ points of view regarding the bone femur. Number 1, this area. Okay, this is the area. This is called fovea capitis. Then ligament attached to it is ligamentum teres. Teres means round. So ligamentum teres of femur or round ligament of femur. The question is, what is the content of this? A branch of obturator artery and a branch from medial circumflex femoral artery. Okay, so these two are the contents of ligamentum teres. And then this area is called trochanteric fossa. This area, okay, it is called trochanteric fossa. And trochanteric fossa, inside that you have trochanteric anastomosis, arterial anastomosis, as well as muscles getting inserted. What are the muscles getting inserted into it? That is a question. They are the short muscles. They are called, there are 4 muscles. One is tendon of obturator internus. Above that you have superior gemelli, inferior gemelli, and quadratus femoris. All these 4 muscles are lateral rotators of hip. So this is the MCQ. The short muscles which are getting inserted into the trochanteric fossa acted as lateral rotators of hip. So this is one important MCQ. And the last one is trochanteric anastomosis. Trochanteric anastomosis, how it is, you have 3 vessels. Number 1, this is called superior gluteal artery. So the descending branch of superior gluteal artery, and here ascending branch of medial circumflex femoral artery, and this one ascending branch of lateral circumflex femoral artery. So these 3, they form the trochanteric anastomosis inside the trochanter. So these are few important MCQs related to the head and neck of the femur. And the next comes your neck shaft angle. Neck shaft angle of the femur is 125 in adults. In females it is lesser than this because of the wider pelvis. The next one, gluteal tuberosity. Just 1/4 of the gluteus maximus gets inserted into the gluteal tuberosity, and this is your greater trochanter and this is your lesser trochanter. And this is the anterior surface, you have the intertrochanteric line, and posteriorly you have intertrochanteric crest. And here you have the line called linea aspera, and it has 2 areas, and this one is medial side and this one is lateral side. Here all the vastus lateralis, vastus medialis all gets inserted in the anterior surface. This will not be asked. Next, so you know the greater trochanter, and the muscles attached to the apex of the greater trochanter is gluteus medius and gluteus minimus. If you come down, here you will be having the attachment lesser trochanter iliopsoas. Okay, these are the MCQs in this region. And if there is any fracture in the neck of the femur, you will not be having blood supply to the head of the femur, so it may lead to avascular necrosis of the head. And if you come down, here you will be having, this is lateral, no? This side you have a groove in the lateral condyle that is called popliteal groove, where your popliteal muscle takes its origin. So intracapsular origin, this is the MCQ for popliteus, which takes its origin from the popliteal groove, which is present in the lateral condyle of femur. Action is unlocking of the knee joint. Unlocking, this is the MCQ. So unlocking of the knee joint. And next is here is the muscle vastus intermedius, and here the part of vastus intermedius is articularis genu. So anterior compartment, you have lot of muscles are there in the anterior compartment. And before going to the muscles of the anterior compartment, we should know trochanteric anastomosis we have read. Next is cruciate anastomosis. This is called cruciate. So here from down you have the inferior gluteal artery, and here transverse branch of medial circumflex femoral artery, and here transverse branch of lateral circumflex femoral artery, and this one is the first perforator artery. Already we have learnt about the trochanteric anastomosis, where you have the ascending branch, but here you have the transverse branch. Same medial circumflex, lateral circumflex. Here instead of here you have the inferior gluteal, here you have the superior gluteal artery. That's all. This is the difference between these two. So definitely it will be asked as an MCQ.